Hey, everybody. I'm excited to kick off part two of Renewals Unfiltered. We're going to cover your options, your organizations, and what your next move should be for your upcoming benefits renewal. I'm Nick Manzanotti, and I'm excited to be joined here by Shelby Wolpa. And I'll give a quick introduction and then turn it over to Shelby. I've been in the employee benefit space for 11 years, primarily on the market side, helping employers navigate these tricky renewals. Since joining the industry back in 2015, it's been year over year renewal increases, and a lot of factors go into that. But at least our team here at Nava is doing our best to help mitigate these renewal increases for organizations your size. So I'll kick it over to Shelby for an introduction, and Shelby, take it away.
Awesome. Hi, everyone. Thanks for joining us today. If you haven't already, we'd love to hear where you're dialing in from. So if you haven't added your name and where you're from in the chat, we'd love to say hello. A little bit of background on me. I have spent the last over 20 years in the people ops space, scaling hypergrowth venture-backed tech companies such as Palantir, One Medical, Instacart, and Envision. And so what this means is that I have been you. I have been in your seat, the one owning these tough benefit renewal discussions, taking good numbers or bad numbers to the CFO for approval, and figuring out how to communicate change to employees effectively. So that's definitely the perspective that I'll be bringing to this conversation.
Awesome. I'm glad to have you here, Shelby. Look forward to the conversation as well. All right, to kick things off, we're going to start with a quick recap from part one. For those of you that joined us on July 22nd, we covered medical trend, which claim inflation trend is 8.5% to 10%. The third straight year near double digits. Now, when you look at fully insured middle market employers, it's hitting you the hardest. And I would probably say that the fully insured trend for insured premium renewal increases is somewhere in the 15 to 20% ballpark. So the old playbook of waiting for your renewal, shopping the market, vetting carrier options less than a couple of months from your renewal date is out to date. Doesn't work anymore, and you have to make a pivot. When you look at the word on the street, you're not alone. So these are primary headlines from the Wall Street Journal, from Forbes, from CNN, from the New York Times on the health insurance market today. Last year, the premiums increased by the most in the last 15 years, and we expect 2027 to be on par or worse. When you look at the Buca stocks, you look at they're in business to return shareholder value. And since the passage of ACA in 2008, Cigna's stock price has increased 19x. United Healthcare stock price has increased 15x. And so there's misaligned interest here, and you need a broker partner out in the market looking out for your best interest. So getting into today's agenda, we're going to run through your options explained. I'm going to hand it over to Shelby for covering getting your organization ready from the HR lens, and then your next move. You ready, Shelby?
Let's do it.
Cool. Starting with your options explained. So before you pick an option or a pathway or renewal strategy, you have to know your numbers. From a demographic standpoint, knowing who's on your plan, your employee to dependent ratio, the average age, what's your demographic from a male to female ratio standpoint. Looking at your claims data. So most of you, if you are fully insured, you might get little to high level summaries of claims data. If you're self-insured, you get all of your claims data. So getting access to that claims data to understand really what's driving your spend is most important. And then the third is benchmarking. So understanding where your organization sits from a plan design, from a cost, from a contribution standpoint versus your peers in your industry, for your employer size, and for your region. Once you understand your numbers, you can move on to knowing your priorities. Shelby, I'll let you take it from here.
Awesome. Thank you. So yeah, priorities. Here's the thing. Every time I've seen a benefits change go sideways, whether that's employee backlash, a CFO who won't ultimately sign off on the plan, or you as HR leaders just like not feeling really good about where things end up in land with your renewal, it's almost always because you are kind of in a reactive place. You're not in the driver's seat and asking questions up front of what do we actually care about most as a business. You're sort of reacting to whatever like renewal gets put in front of you. So let's talk through 6 possible priorities. We've got cost, benefits quality, bandwidth of your team, employee satisfaction, employee disruption, and risk tolerance. So what I want you to do now, and this could be a bit of homework after this session, is to really think about this list of 6 priorities. And stack rank them based on different scenarios. So as an example, first, if you get this amazing renewal, a single digit renewal, say 5%, how would you analyze your priorities? Maybe your top 3 are benefits quality, employee satisfaction, and cost. But then on the flip side, imagine you're hit with the worst news and you get a 40% renewal. Suddenly cost jumps to your number one problem, your number one priority that you have to deal with. This also likely means you're going to have to make some like big shifts in your benefit plan design that's going to disrupt your employee population. And it just, you can see how based on these different scenarios you can be dealing with a whole a wide range of outcomes. So it will really be helpful to proactively think about this list and think about certain things at your company that are non-negotiable. Like I know when I work with my clients, whether right or wrong, sometimes the founders will say, we must have this contribution strategy. And this is the most important selling point to candidates, and we are not going to touch that. And so that's just really good to have clarity on going into these negotiations and to be speaking about with your finance teams.
Spot on, Shelby. Spot on. So knowing your numbers, knowing your priorities, and then you're ready to look at the options landscape. So we're going to start with the funding spectrum. There's a bunch of insurance jargon here, so bear with us. You have fully insured, which is paying a fixed premium to the carrier, and the carrier pays all claims. Although they don't share a lot of data on the claims that they're paying out, nor the RX rebates that they're keeping, and a lot of the shenanigans behind the scenes. You have level funded, which is paying a fixed premium, but it provides some of the upside as if you were self-funded. So if your claims run really well, you'll get a surplus dividend of the excess premium at the year's end. So level funding is a nice middle of the road. You get a fixed premium, but the upside of self-funding. Then there's self-funded, which it sounds scary on paper, but it peels back the onion layer on the fully insured model and allows you the flexibility to plug and play best-in-class vendors across your entire health plan ecosystem. You should have a really solid benefits broker partner to do the heavy lifting here. Sounds more complex than it really is, but it allows you to get full and complete data transparency, to strip out the majority of cost fat that's baked into a fully insured plan, and to implement the right programs to address the high cost ticket items within your health plan. And honestly, to put in programs to help your employees live healthier. Then you look at the tactical levers. So you can stack these on top of any funding model. You have care navigation and steerage solutions. You can address population health, which is the largest driver of your health plan spend. You can look at PBM, which stands for Pharmacy Benefit Manager Management. And this is a big sticking point right now. Back 10 years ago, when you look at the overall health insurance spend, pharmacy might have been 10% of that, with medical being 90. That number is now up to about a 70-30 split. And in some scenarios, we're seeing organizations having 50-50 split between medical and pharmacy claims. So you're going to continue to hear PBM pharmacy in the news, and should be a focal point for you in managing your health plan going forward. Specialty drug programs. There are more specialty drugs hitting the market today than there ever has been in the past. The number one being GLP-1s, everyone's favorite buzzword, but the buzz is real. The results are pretty drastic for those on GLP-1s, and employers are now navigating how to cover those, whether it's just for diabetes, whether it's for weight loss, and what their peers are doing. So benchmark what your peers are doing and keep an eye on specialty drugs going forward. And then variable copay programs, structuring your program to incentivize employees, making good healthcare decisions, seeking higher quality of care, and paying less for making those good decisions through variable copay programs. And then last but not least, on the option landscape, we got defined contribution and individual market solutions. I don't love this word, but it sounds icky, but it's called ICHRA. It stands for Individual Coverage Health Reimbursement Arrangement. And this allows you to put in an administrator, giving employees a set dollar amount to go purchase plans on the individual marketplace. Yes, it does allow you to escape the year-over-year renewal process. You will not have a group health care plan going forward, but it does satisfy the ERISA and ACA requirements for middle market employers in terms of offering a group health care plan coverage. And it gives employees the choice to select a plan that's best for them and their families. The key here is finding the right ICHRA administrator, and we have a few in mind to go forward with if you are going to go down this pathway. And the same goes for QSERA, very similar to ICHRA. The biggest lever that you have, though, is funding. So when we look at the three funding options, you have fully insured, level funded, and then self-funded. Fully insured is the easy button. Most of you are probably very familiar with this. You pay a fixed premium, but you have less visibility into the claims spend through your plan, into how the program's working. And even with a low loss ratio, which is the claims that the carrier pays out versus the premium that you pay in, you're very likely to get a year-over-year renewal increase. When you go level funding, you do have that fixed premium. So very similarly to the fully insured option, you're going to pay a fixed cost every single month, no matter how high your claims run. But if your claims run really, really well, you are in line for a dividend surplus of the premium at the year end. If your claims run really, really high, I would also expect a relatively large renewal increase. But one of the best pros on this, outside of that dividend surplus of the premium, is you get access to high-level claims data, something that is not typically available when you're fully insured. Now, when you go self-funded, you have more control and more visibility. It is certainly a bigger lift for HR teams to go down this pathway. But honestly, it's more of an education curve than it is an administrative lift. The broker should be doing most of the heavy lifting. And when you go self-funding, you have complete access to your claims data, complete plan transparency. You eliminate a lot of the carrier profit taxes and risk transfer as you would pay if you were fully insured or level funded. And it allows you to truly run your health plan like you run every other aspect of your business. PBMs and specialty drugs. So 40% of overall health insurance spend is now concentrated on the pharmacy side of things. And again, this number kind of varies by employer. Claims data will tell you this from the carrier if it's made available. But we're seeing this number continue to uptick year over year, where pharmacy might outweigh medical claims here in the near future for the majority of employers in the US. When you peel back the onion layer too on just the pharmacy spend, 50% of pharmacy spend is on specialty medications, which typically represents 2% or less of your overall number of scripts through your health plan. So, and these specialty drugs are going to continue to hit the marketplace. So be mindful of this, monitor your specialty drugs spend, and there are levers you can pull to still provide the same quality of medications to your employees, but at a lower cost. And then last, kind of one of the primary reasons there is this uptick in specialty and prescription drug spend is because 80% of the PBM market is owned by the health insurance world. And actually so much so, there's so much money in pharmacy that a PBM, most notably CVS Caremark, purchased Aetna, the third largest health insurance carrier in the country. The other two PBMs, Express Scripts is owned by Cigna, and then Optum, which is owned by United Health Group, or UHC. So literally 80% of the prescription drug spent for employers in the US is controlled by those three PBMs. There are alternatives, much more transparent PBMs that you should be considering. And when you look at the 5 levers to help control PBM spend, it's primarily on the self-funded side of things. So if you're fully insured, you're kind of stuck with the formularies in the pharmacy solutions that the insurance carrier is providing. But when you're self-insured, the world of opportunities expands, and you can explore carving out your pharmacy to a more transparent PBM. You can examine the formulary and look for biosimilars or lower cost drugs that might be available with the same efficacy for the drugs your employees are currently taking. You can put in the proper guardrails through step therapy programs and prior authorizations. You can look for pharmacy coupons, most notably GoodRx and a few others that are out there, that employees can get a much lower out-of-pocket cost for their drugs versus going through the health plan. There's PAPs, or patient assistance programs, that employees might qualify for. And then last but not least is the lowest net cost. When you look at your PBM, lowest net cost stands for 2 things: the discounts you're getting on drugs and the rebates your PBM is paying for those drugs. So the rebates can be a shell game. If your PBM is pitching higher rebate amounts, they might not be giving you the best discounts. And vice versa. If they're pitching the highest discounts on drugs, you might not be getting the best rebates. So it's really, really important to factor in the lowest net cost when you're examining and evaluating PBMs. The next lever is population health. And so whether you're fully insured or self-funded, population health is super important, because 80% on average of what's driving your health insurance spend is the health of your employees, is the utilization of your health plan. And for most middle market employers, it's a pretty consistent set of conditions. The usual suspects from cost drivers are typically musculoskeletal, cardiovascular disease, cancer, mental health, diabetes, premature babies and premature births. So when you look at these small number of conditions that drive a disproportionate share of total overall spend, you're able to implement targeted programs that don't put in guardrails for employees, but they simply give the employees a choice for higher quality of care and to pay less out of their pocket. So it's super important to review your top conditions driving your spend, and to either look to the carrier or the TPA for those programs to address those conditions. But the TPA and carrier don't always have the most effectiveness in their programs to address those, which would then lean you to look to a third-party solution for each of those top cost-driving buckets. Shelby, from your side of the table, how do you think the HR team should approach the population health conversation?
Yeah. Well, first of all, I feel like you're giving us all a PhD in healthcare. So this is amazing so far. Thank you for sharing all of this knowledge with us. It's really cool to see. So this is a really interesting one, population health, because like you said, a lot of startups are fully insured, and you just like don't have the transparency and access to a lot of the information, or solving a problem like this feels really hard, because we also have like all these other things that we're responsible for on our plate. So I think the honest answer of how HR teams approach this is that they don't know where to start. They think, when it comes time for benefits renewal, they're thinking very short term, very immediate, and thinking about, long-term population health is a more like long-term strategy play. It also means that you maybe are making decisions that don't necessarily make sense in the short term, but like will have a payout a few years down the road. And so that can be a harder sell for executive teams that like aren't also thinking strategically like that, or prioritizing that so much. So I think, something that needs to begin as a conversation inside your company are having conversations that stop being about how do we manage costs and start becoming, how do we keep our people healthy? This list that you mentioned here around musculoskeletal, preemie babies, mental health, these are all things that I'm seeing inside the companies that I work with. We've got, we all sit at desks. We've all got like spinal back issues. Lots of people are having babies. Like these are really what drive your claims costs up and aren't really going anywhere. I think it's like a really interesting discussion that you can have with your broker.
100%. Yeah, I can't agree any more with you. And that is the number one way outside of course, changing carriers to honestly reduce cost over time, is to instill a culture of population health and wellness in your organization. Awesome. Another lever is care navigation, RBP, which stands for reference-based pricing, and ICRA. So I'll kick it off with care navigation. And primarily this is defined by steering employees to high value providers and incentivizing employees to do so through lower cost sharing. So oftentimes when you look at a carrier network or a BUCA network, Blues, United, Cigna, Aetna, their provider contracts prevent them from providing a lower cost share to go to one provider over the other. So there are third-party care navigation platforms that are agnostic in the marketplace that have the quality data on hand that can help employees identify who are the A+ doctors versus the D or F doctors, and then incentivize employees through plan design, lower contributions, lower cost shares for seeking care through these higher quality providers. So it's a great program. But what's to watch for is it needs engagement. There is a learning curve when you put in these programs. It might be an extra step for employees to log into an app to search for care through that app. So there is a learning curve, but even with minimal engagement, it can lead to healthier employees, and an ROI for employers and more money in employees' pocket. Reference-based pricing is not a newer strategy, but it's a strategy that has gone in waves over the last 10 or 15 years. It definitely is a regional play. So it's not right for employers in specific markets or certain markets, whereas in the Midwest, for example, primarily in Ohio, Michigan, Indiana, you're starting to see reference-based pricing really pop up. But in California, it's not gaining as much traction. There's a lot of reasons for that, but reference-based pricing in and of itself is hiring a third-party administrator to reimburse providers based on a percentage of Medicare. So for example, your TPA is going to pay the Cleveland Clinic 130% of Medicare, or whatever the number might be. For context, a BUCA network, Blues, United, Cigna, Aetna, they reimburse providers on average anywhere from 250% up to 600% of Medicare. So the savings are drastic. But if you go down the reference-based pricing route, understand and realize this is not a network. There is no contractual agreement between the TPA in a network and that provider. So this leads to potential balance billing issues and employee relation issues. So this also the success of this program relies on education. And I would only recommend this if cost is your number one priority and employee disruption is secondary to that. Shelby, I'm going to pass it over to you for the ICRA solution.
Sure. So you spoke about this briefly earlier, but to elaborate, an ICRA is the employer saying, instead of choosing a plan for everyone, I'm going to give each one of my employees a defined dollar amount, and then they can go out to the individual market and buy a plan that's right for them. You said this earlier, Nick, a lot of employees are overinsured, because the company's trying to be competitive and offer a great plan, but most people, we all have very varied needs of what we need from our healthcare. And so a one size fits all approach often means that some people are overinsured. So it puts more choice in the employee's hands, which can be a really good thing for a workforce that's distributed and has, like I said, if you and me, Nick, we're going to want different things out of our healthcare plan. One thing to keep in mind here, because I work with a lot of distributed teams that have people in like 30 states or multiple countries, is that the available options will really vary in different locations. And so something to work with your broker on in advance before just going forth and going with an ICRA is to do a little analysis and make sure that you've got good coverage options for people and that you're not going to be leaving some people hanging that live in smaller pockets around the country. Let's see. So one of, I think, both you and my favorite ICRAs is a company called Thatch. They are trying to help employers solve this and be able to offer ICRAs to their employees. They are very helpful in helping you manage the compliance and the administrative side if you're considering this option.
So we've covered a lot of options, and you're probably wondering which option is the best route for you. No single option is right for everyone, and it really comes down to your risk tolerance, balancing where you are in terms of benchmarks, balancing your employee demographic, and then working with your broker partner to identify what options are out there, doing the evaluation, and being ahead of the curve from a proactive standpoint. Because as we all know, the couple of months leading up to renewals, especially for those of you with a 1-1 renewal around the holidays, it's pretty chaotic. So getting out ahead of that is super important. If your top priority is status quo, if you like the easy button, be prepared for a renewal increase, and we would recommend staying fully insured. If you're looking for cost reduction and data visibility, we recommend a funding change, either level funding or self-funding with a third-party administrator and having stop loss in place to protect against high-cost claims. If you're looking for cost reduction and low disruption tolerance, we'd recommend examining your PBM or pharmacy situation if you're self-funded, or looking to a care navigation platform, which you can layer onto your existing plan. If your top priority is flexibility for a diverse or distributed workforce, ICRA might be the best option for you, giving the employees the choice. If resetting a high-cost baseline with the employee disruption is secondary to cost, then consider reference-based pricing. At least go through the evaluation, have your broker talk with vendors, maybe meet with them and run a repricing analysis, but it's definitely worthwhile to evaluate. If you're looking for most control and you have bandwidth, self-funded, unbundled, or even bundled with a BUCA carrier, Blues, United, Cigna, Aetna, would give you the most control. It has the most complexity, but it certainly has the highest upside and allows you to run your health plan like you do the rest of your business. All right, that's the full menu of options. So now that you have a clear picture of what's available, how to evaluate it, and which option probably fits your situation best, I'm going to hand it to Shelby, because picking the right option is only half the equation. The other half is what it actually takes to make any of these changes happen inside your organization. And that's where her experience is irreplaceable. Shelby, take it away.
All right. Okay. Thank you so much, Nick. Yeah, Nick is so right. I talk a lot about, being a people ops professional. We can often go into a black box and do all this amazing work behind the scenes, or we're working with our broker for months and months and months. And then we come forward to the organization and say, here it is, here's this beautiful end result. And then the business or the executive team is like, what? We didn't know you were working on this. We aren't aligned with this. And so in general, my advice is to not be a black box. But we're going to specifically talk about some best practices today, about how we can move you from the left hand, like the reactive place, to the green zone and the proactive place. It's very common that we are in the red box when it comes to benefits open enrollment. We've talked about this a lot today, that we're just waiting with bated breath for our renewal numbers, and then we're scrambling to figure out what to do about that. And my goal for you today is to walk away with a different plan, a different, number of steps that you can take to get yourself into the proactive, strategic seat. So I think that this is also kind of being in that like scrambled reactive place is just really, really tiring. And I want this to be a positive experience for you and you to show up really well inside your organizations. The goal here is that your CFO is on board, your employees have a heads up as to what's coming. You've kind of modeled out your different scenarios. And then once you have all of the inputs, you're ready to go. All right. So one way of getting out of that reactive and into the proactive place is really thinking through these trade-offs. Every strategy you pick is going to have pros and cons. Nick did a great job of talking through all these different models and all these different ways that you can set up your plan, but there's no one size fits all, and there's no like fail-proof plan. And so I encourage you to kind of think through these different constraints that you have on your team and what is possible. For example, you may say, our team is focused on other priorities. Like, we don't have the bandwidth to take on like a big benefits switcheroo this season. But then you get hit with a 40% renewal and you're like, well, nothing else matters because that 40% hit to our business would be really detrimental, and we've got to, quickly pivot and focus on that as a team. So just, think through these different priorities that you have as a business and which trade-offs you and your leadership team will accept. Which ones would create real problems internally versus things that you feel the business can stomach and can adapt and handle. It will just really help to start having these conversations now in July and August, not having them in October when you're panicking. Okay, so let's talk a little bit more about this kind of CFO conversation, or whoever in your finance team is the ultimate approver of the budget around benefits. Because this is a conversation that I've seen HR teams avoid or just kind of not show up as great as they could. And, feel really, that you're using your PhD skills that you learned here today. So again, my biggest piece of advice is to start having these conversations with your finance team now. Understanding a range of possibilities. Share the New York Times article, share the recording of this webinar, get them educated on the landscape of benefit costs, because in most organizations, benefit costs is the second number one spend, second to salaries. And so we're talking about, real financial impact here, and something that your CFO likely cares about or should be focusing on more. And I'd love for you to be, driving that conversation. It will be important to understand what risk tolerance your finance team has. Are they open to self-funding? Are they open to level funding? Like, start, having these conversations now. If they need to have a demo, if they need to get some education, like, let's do that in these summer months, and not again once like we're in the reactive seat reacting to our renewal. And yeah, I would just say that, the way that these, like when I've seen these conversations go the best is when a lot of this like strategy work and long-term decision-making is happening months before, we're deciding what 2027 benefits are going to look like. I love giving like a 3-year plan when I'm developing my benefits recommendations for the following year, that, here's the decisions we're making for next year, but here's our longer term play and here's what we're working towards. I think is, really smart and helps you look awesome. And then finally, last but not least, is all of the change management around benefits renewal, and how we, talk to employees about what's happening, so that they feel that they're coming along for the journey and that there's no surprises for them as well. Because I think we've all been there. We could have the best of intentions with things that we're trying to communicate around things that are hard, like benefits and comp and performance reviews and promotions, and we could have the best of intentions, but if we don't get the comms right, it can just all go sideways, and can feel really bad. Um, and that's just the sad reality. So I've learned a lot along the way. Here are just 5 things that I want to cover today, in how you can think about the framing for your communications is to be honest, like be as transparent as you can about why you're making the decisions that you made. I always like to start with what's staying the same. So if really like not much is changing, but we're changing like one thing about the plan, just say that up front. To say, this and this and this and this is all staying the same. The one thing that's changing is this, and here's why. And then third is explaining the trade-offs. Like I said, with transparency, like people are not dumb. Like they're reading the news, they're hearing about inflation and rising healthcare costs. And so being open about, some of the things that you considered and why you said no or yes to certain things can really help build trust, and have the message land a little softer than it might have otherwise if they understand like, okay, wow, like they really did an exhaustive, like lots of research, lots of strategy. Like, yes, there's going to be more money coming out of my pocket, but like I understand why and like that they did their best. Fourth is give people somewhere to go. I think this is kind of HR 101, but don't just deliver this news in an email. I would encourage you to, whatever your company has, if you have a culture of like weekly all hands meetings, or if you have HR office hours, like set up different ways that people can get in touch with your team throughout this process, share feedback, ask questions, try to be open and be listening as much as possible. And then finally, don't wait till that open enrollment message, where you're like, oh no, I'm going to press send on this email and then run out of my house because like I'm scared of what people are going to say. I think you can relieve that pressure by taking them on the journey. So at different moments between now and October, be sharing that like, hey, we're heading into renewal season. We're starting to think about our benefit strategy for next year. Here's some of the things that we're considering. We will be updating you along the way as soon as we know more, just so they know like this is something that you're not taking lightly. You're putting a lot of thought into it, and hopefully no surprises.
All right, before we go to your next move, I want to show you what a well-run renewal actually looks like. And so we start the conversation early. You have to know your numbers, pull data, pull benchmark reports, run an employee survey, marry the employee survey results with the benchmark results, and prioritize investing where the benchmark meets the survey results. Then 6 to 4 months out, it's time to take it to market. Shop all the options in the marketplace. Here at Nava, we have a no stone unturned commitment. We're going to shop all carriers, all plans, all networks that are right for your employee population in your organization. But doing that, even sometimes before you get the renewal from your incumbent carrier, is a perfect strategy, because it takes the time when you send out the RFP, the 2 or 3 weeks, or potentially a month to get a quote back, down to a week, or even sometimes less than that. So getting out to market before you have your renewal sometimes is a great strategy, so that you're ready to go. You have leverage to take back to your incumbent carrier when or if you get a renewal increase. At the 4 month out range, and sometimes that can leak into the 3 months or even a couple of months out from your renewal date, look to get a recommendation. The sooner the better. Options that are modeled with a clear recommendation on the table from your broker partner Of course, giving you the choice from the 2 or 3 options or pathways that are laid out, but having a broker partner that can recommend a plan and then walk that path with you is super important. Leaving you enough time to put together employee communications, host open enrollment, configure your benefits administration system, close open enrollment, obviously get those elections over to the carrier and process so that ID cards and coverage is not a concern when that effective date rolls around. Okay, moving on to your next move. So let's close out with what actually to do this week, because all of this is only useful if you walk away with something concrete. So from the broker side of the table, call your broker and ask the 5 questions from session 1. On the next slide, I'm going to recap what those questions are. Please take a screenshot and field those questions back to your broker. Ask for claims and utilization data from each vendor within your benefits ecosystem. They should have a quarterly report, an annual report. Get your hands on as much data as possible and have your broker synthesize that data for you leading up to your renewal. Have them model a funding comparison for your group. Even if you're self-funded, you can look at varying levels of stop-loss deductibles. You can take a look at your PBM and look at how your plan design is structured. So there are different funding comparisons you can do even if you already are self-funded. Get benchmarked now, not at renewal. Renewal is a time to evaluate the carrier options, your renewal options. So benchmark early, understand where you stack up in terms of your competition, and prioritize where you want to invest in leading up to going out to market and shopping the rates and plans. Also, run an employee survey to get sentiments on the plans. You might think you know how employees feel, but ask them. Keep that survey to 10 or 15 questions at most. Keep it to multiple choice. You can always open it up to typing in an answer there, but you can get a wide variety of answers. So if you keep it to multiple choice, you keep it really specific, and you get actionable insights from that survey data with a high completion percentage rate. And then marry the survey results with the benchmarks and invest where they meet. Here's a quick screenshot. So the 5 questions you should be asking your broker. What are they seeing across their book of business? Is your renewal similar to what they've seen for other clients similar in size with the same carrier? Have you run a claims analysis for us yet? Or are claims even available? Many of you are probably wondering, well, I haven't seen claims. It could be a carrier thing. It could be the way you're structured today, or it could be your broker simply not delivering that to you. So at a bare minimum, at least ask them for an update on the claims analysis. 3, what alternatives are you modeling if the number isn't workable? So have them with a game plan before you get your renewal from your carrier and be ready to rock to go evaluate those alternatives when that renewal time comes around. What's your recommendation to cut the cost without cutting coverage? So savings while increasing deductibles is not truly savings. That's increasing deductibles. So are there areas of opportunity for us to save money without compromising or sacrificing our health plan for employees? And then 5, what trend factor did the carrier use on our renewal? And is it defensible? Honestly, if you look at these carrier renewal exhibits, there is a method to their madness, but oftentimes they use numbers that are inflated versus what is the reality in the marketplace. So your broker should be going back to bat for you in defense of your renewal. All right, Shelby, from the people side, take it away.
Great. Yeah. And I just sitting through those questions, I imagine some people are sitting there thinking, yeah, I don't get this kind of service from my broker. So it might be that it might be time for a change. Who knows? But from my side, in this, I'm just kind of hitting home some of the points that I've made earlier. Start the conversations with your finance team now. Even putting 20 minutes on their calendar just to, plant a little seed that this is happening and this is coming down the road in a few months will save a lot of pain come renewal time. I want you to do your homework about your 6 priorities. I want you to You could even do this with your team. Think about the 6 priorities and what's important to you. What are the deal breakers? Name your leadership partner. This is a huge one, and this is helpful with lots of people programs, is to find what other executive on your team can help champion this for you. Whether that's your CFO, your CEO, your COO, maybe your head of engineering cares a lot about this because they are competing for talent for AI engineers, who knows? But find your leadership partner and don't carry this burden alone. Like I said, this is like a big spend for your company, and something that you can loop in others to help you with. And then start thinking through that employee communications and change management plan. So often it's like the last thing that's done at the 11th hour, the day before the benefits open enrollment meeting. And I really encourage you to start talking now to your teams, so that there are less surprises come renewal time.
Cool. And a quick Nava plug here on our HQ platform, the first of its kind in our industry. When we're talking about claims visibility in a cross-functional platform to be collaborative with your people ops team, with your finance team, and with your broker partner, hopefully Nava, I want to give you a little more context on our platform, because oftentimes teams that are looking for plan performance or engagement reporting or utilization reporting from their vendors within their benefits ecosystem, they might get those reports on an infrequent cadence if they get them at all. And oftentimes it comes on a static PDF spreadsheet or something via email from your broker partner, again, if you get them at all. We've built a platform that provides 24/7 real-time reporting across all benefit vendors within your ecosystem. So we can, of course, send you a benefits spreadsheet or PDF that's static via email, but you'll also have access 24/7 in our collaborative workspace called HQ, giving you the kind of analytics that used to be reserved for Fortune 500 benefit teams, but our platform is built for companies of your size and for organizations that actually need it the most. So if you want to take a look, the link will be in your follow-up email after this webinar. So wrapping up with 2 things to leave with. I love the quotes on the screen from both myself and Shelby. We'll recite them here though. The employers who come out ahead are not the ones who got lucky on their number. They should have prepared. They knew their options and they had a broker already working on an answer. So just prepare heading up to your 1/1 renewal or whatever your renewal date is. It's July 4th. So we're in crunch time right now for that 1/1 renewal strategic game planning. Be prepared, rely on a great broker partner to walk you down that pathway. Shelby?
Agreed. And just another +1 for the Nava HQ platform. I remember the first time I saw it, it was one of those aha moments that I was like, well, the traditional broker model is dead to me now. And, slow 2-week turnaround spreadsheets are just not going to cut it anymore. So I'm a big fan of what you are building over there. And just +1, kind of building on these ideas. The ones who make change stick built alignment before the pressure hit. Asking your broker to start strategizing with you, or if you heard terms today that were new, like even some of the ones that Nick covered, like I'm not super deeply knowledgeable in, start researching on your own and start educating yourself to see if some might be a good fit for your company, and start those conversations now.
Super well said. Super well said. So your questions answered. That's everything from us. We're going to hand it over now to a live Q&A, and you can drop questions in the chat for Shelby and I to answer. But we thank you all for joining, and hope you took away some concrete action items, and look forward to continuing the conversation with you. Thank you.
Awesome. Thanks, everybody.